Hi everybody, Jay with Somnilopod here. Before we get started, I do want to ask you to hit that like button and subscribe if you are so inclined to find out more information like we present on these videos. Check out the companion podcast, Somnilopod, at any of your podcasting services. So today's question, is Covidsomnia real? We've heard this term over the past couple of years, and it actually talks about a group of symptoms that are group linked together and labeled as Covidsomnia. Now, we've all heard of insomnia, which is just difficulty getting to or staying asleep. But that, coupled with an excessive amount of daytime sleepiness or fatigue, as well as an increased use of sleeping medications or self-medication, they can be over the counter or use of alcohol, things like that. All of these combined together have been labeled as Covidsomnia. Now, it is a very real occurrence as a result of all of our lives changing so much as a result of the coronavirus. Some people have found themselves in the situation where their lives are so drastically changed that their sleep routine has been set askew or offset for some reason. So, for example, those people that are now working from home, they may find themselves getting up a little bit later than they normally would. They may not stick to the same routine. They may find themselves napping a little bit later in the day. At night, even those people that may have lost a job, for example, may find themselves staying up later than they normally would because they don't have a specific reason to get up during the day. So as a result, they may find themselves self-medicating or even talking to their doctor about some things they can do to help get some medication to help them sleep. So all of these types of symptoms linked together are Covidsomnia. Now, there are things that we can do to help ourselves overcome this. For example, paying attention to your daily routines is going to be one of the biggest things that you can do to help. Daytime routine, getting up at the same time every morning is going to be one of the biggest things you can do. Make sure you expose yourself to some sunlight as well. Start and maintain your exercise regime. Exercise has been shown to help solidify our nighttime sleep. Even your nighttime routine, you may want to pay attention to. So not necessarily going to bed at the same time every night, but try to follow the same types of behaviors at night before you go to bed. Limit your screen time before you go to sleep, about 2 hours. The bright light from TVs and monitors and cell phones, iPads, things like that, can affect our ability to get to and to stay asleep. You also may want to try to incorporate some sort of soothing nighttime routine, maybe turning the lights down a little bit, read a book, take a warm bath. Studies have shown that affecting our temperature like that can help our body cool off a little more quickly and thus induce sleep a little bit better. So try some of these things. If you're still having some issues, talk to your doctor. It's going to be a good opportunity to start a conversation with a healthcare professional to improve your sleep during this increasingly irksome time. As I said, if you have any questions, don't hesitate to reach out to me, Jay at Somnilopod. And also, please remember to hit like and subscribe. And until next time, please be sure and make sleep a priority. Thanks so much.